Well, I want to start the program today by, of course, introducing our very special guests. And we have three guests. And they've been with us before because during this time last year, which is in September, we celebrated, and I could say celebrated because, of course, we know, although it's a disease or an ailment we're going to be talking about, we want to highlight it, and we want to highlight the needs of the women that are affected by this condition. So, of course, we're talking about PCOS. And many women know more than, and I would say to the credit of these folks, and of course, the others who would have participated in research and activities, now know more about PCOS. And I want to congratulate all of them, especially Dr. Mohammed, for raising the bar, raising awareness about PCOS in Trinidad and Tobago. And of course, our other guests, Prof. Sundaram, Prof. Azziz, and of course, Prof. Kubun, who isn't here with us, but of course, you would have heard from him last year because he did substitute for me when I couldn't do the show. So we have quite a lot to talk about, but I want to officially introduce our guest. And I mentioned Dr. Mohammed, and she's a researcher at the Faculty of Medical Sciences at UWI, and she's currently a postdoctoral fellow at the University of Pennsylvania. For the past 8 years, she studied PCOS in both humans and animal models and was part of the first team to estimate the prevalence of PCOS in Trinidad and Tobago. And we're going to be talking about that some more. She has received local and international awards for her work, and she's very passionate about raising awareness about PCOS and PCOS education. We also have Prof. Sundaram, and Prof. Sundaram is the Deputy Dean for Basic Health Sciences at the University of West Indies in the Faculty of Medical Sciences with over 25 years of teaching experience and research experience. He's an expert in reproductive biology and has guided major research in PCOS, including work in Trinidad and Tobago and right here in Trinidad and Tobago, and of course, other parts of the world. He's received multiple awards for his contribution to science and education, and he continues to mentor the next generation of researchers. Prof. Ricardo Azziz is an internationally recognized physician, scientist, and executive, best known for his expertise in PCOS and androgen disorders. He's published over 500 scientific papers and has held leadership roles in major universities and medical organizations in the United States and other parts of the world. Today, he continues to shape global understanding and treatment of PCOS and women's health. So I want to welcome all of you very distinguished guests we have today on Diabetes and You. Thank you all for being here.
Thank you for having us.
And I started the program by just saying how grateful I am, because we would have done similar programs last year in September. And I think since then, more people now know about PCOS because of programs like this, but because of people like you all and raising the bar. And I know that the women who are affected by PCOS are appreciative because they now know how to take care of themselves better. They now know how to really deal with it. And again, this is the aim of the work that we do here as well. Today, of course, specifically, we want to focus a little bit more on PCOS and diabetes. And I want to start with you, Prof. Azziz, because I want to find out from you, and again, talking to our listeners and viewers, let us know what exactly is PCOS, and then also tell us how it relates to diabetes or the metabolic health of women. So let's talk about that.
First, I wanted to thank you for hosting the show, Dr. Dunowitz. It's very important, and it's great to see Dr. Sundaram. You know, he's the professor has been very supportive of all the work, and of course, they're very energetic and always on the point. Dr. Stephanie Mohammed, Stephanie, it's always great to see you. So, what is PCOS? Let me just start out by simply saying that PCOS is a syndrome. Right? And that means it's a collection of signs and features. There's no one test that tells you that you have PCOS, right? So I think everybody needs to know that. It is the single most common hormonal disorder of women worldwide. You know, and we've proven that in Trinidad and we've printed in many other parts of the world. It includes the signs, if you would, the things that make you think maybe I have it, are two things. Do you have irregular periods, too frequent period? They're absent at all. These kind of things. If the periods are not regular, predictable, monthly, particularly if they're associated with, say, breast tenderness and so on before your period, if you don't have that, then you may fall into a risk group that may have PCOS. The second is, do you have excess male-like hair growth? Do you have hair growth on your body and your face, et cetera, that suggests that? So those two things are very predictive of PCOS, okay? And so PCOS is a syndrome. We call it an endocrine syndrome, a hormonal disorder, but it's very, very much associated with abnormalities of what we call metabolism, right? That leads to diabetes, heart disease, vascular disease, stroke, and so on, which we'll talk a little bit more about it. So again, PCOS, a syndrome, fairly easy to begin to suspect it based on either irregular periods or excess male-like hair.
And Prof, and just for, of course, our listeners to know, we will be opening the phone lines and taking some questions a little bit later on. But one of the questions that I think may be on the tips of most persons' minds talking about this condition, can it affect women of any age, or when is typically the first time women may see these symptoms appearing?
You know, that's a great question. So PCOS is a genetic syndrome. I think it's what we call a complex genetic trait, but not to make it complicated, it's a genetic syndrome. And so while external factors may modify the appearance, the development really is a factor of inheritance. That means it's a lifelong disorder, right? You have it as a child, you have it as an older woman, you have it as a male, you have it as a reproductive age woman. But the symptoms most clearly appear for most women, not all, sometimes they appear in childhood, but for most women, they appear as they transition into their menarche, as they transition to having a period, okay? And so that's really when you begin to find out that you have it, okay? During that period of time. Usually what happens is your periods become somewhat or are irregular as you begin to have periods, right? Age of 11, 12, 13, they stay irregular, they don't get better. That begins to suggest PCOS.
And so we will have mentioned initially that today we're going to discuss the relationship between PCOS and diabetes, and we often know that there is a very strong relationship in that insulin resistance is involved. So I wanted to explain to our listeners why is insulin resistance so important when thinking about the link between PCOS and type 2 diabetes, especially. Can you explain that to our listeners?
That's a great question again. So let me just start back by telling you what insulin is. Insulin is a hormone that is produced by your pancreas. Pancreas is an organ right behind your stomach, if you would. And that insulin is what controls your sugar level and your fat levels in your blood, right? Not enough insulin, you become massively diabetic, your sugar levels go up, you can die, etc. Your fats and what we call lipids in your blood also become abnormal. So that's what insulin does. Insulin is a very powerful hormone. It not only controls sugar and fat in blood, but it also controls other factors, which is part of why this happens. So insulin resistance means that your body has a generally genetic reason for being resistant to insulin. In other words, insulin doesn't work as well controlling your sugars and your fats in your body as it normally would. Now, most people who become obese become insulin resistant just by their obesity. But again, for many individuals, being insulin resistant is a genetic disorder. So what happens? Well, so your body has resistance to insulin. If you're healthy, a young, healthy woman, like most of our PCOS patients are, your pancreas begins to put out a lot more insulin, right? They put out a lot of insulin to compensate, right? To make sure you're not diabetic. That excess insulin is what leads to many of the signs and symptoms of PCOS. It acts on the skin to make your hair grow faster. It acts on your ovaries to make your ovaries produce more male hormone. It acts on the liver to produce less protein that traps male hormones. We have more free male hormone and so on and so forth. So that excess insulin that happens with PCOS women is what tends to drive a large amount of the symptoms, if you would, the features of PCOS. I should tell you that about 85% or so of women with PCOS have insulin resistance. So it's a very common thing. That insulin resistance also puts strain on the pancreas, right? I mean, the pancreas got to put out a lot of insulin, has other side effects, but eventually it starts to peter out, right? I mean, there's only so much you can demand on the pancreas. It begins to peter out, insulin begins to drop, and you begin to develop diabetes. And that's how the link occurs.
And therefore, we know that women with PCOS are at risk type 2 diabetes, are at higher risk of type 2 diabetes. But is it inevitable? Is it inevitable that a woman that has PCOS or symptoms of PCOS now, is it inevitable that they're going to develop diabetes, type 2 diabetes, or what can they do?
Well, no, it's not inevitable. And I think that we should understand that women with PCOS are at risk for developing diabetes. About 20 to 30%, depending on what population you look at, may develop diabetes, but a large proportion of them will not. Obviously, you can do lots of things to prevent that. You can, lose weight if you're overweight. Yeah. Not all PCOS patients are overweight, only about 40% or so. So we have to be careful. And of course, it varies by country. But you can lose weight. You can exercise. Doing exercise will help you burn sugar without needing insulin. You can eat well. You can eat healthy. You can stay away from unprocessed food. And you also can take certain medications, right? Metformin may help your insulin resistance. Inositols, depending on, although the data is less, can also help you with your insulin resistance. So there's a number of things that women can do to help prevent the development of diabetes if that were their risk.
And that's important to note, especially for our listeners who may be affected by PCOS, knowing that they have stacked risk factors, because many of them may have already previously have other risk factors, being just, ethnically Indian or African descent automatically puts them on higher risk. Having PCOS means that you have a higher risk, meaning that you need to take more steps to prevent yourself from developing diabetes. And of course, thanks for that, sharing that information.
Well, before I finish, family history is a very important one, right? If your family has a high risk of, a history of having diabetes in the relatives, heart disease, stroke, that also puts you at higher risk. But thank you.
Yeah. And I'll come back to you shortly, Prof. Azziz, because we want to talk some more about that. But I want to turn the conversation a bit to Dr. Mohammed. And as I mentioned before, she's a researcher, not in Trinidad right now, but has worked in Trinidad for quite some time and has pioneered and I think championed, pushed the PCOS work in Trinidad, of course, with all of the supporters around her. I want to ask Dr. Mohammed first, you and your team were the first to really estimate the prevalence of PCOS in Trinidad. Tell us about your findings and why is it important why are these findings important for women in Trinidad and Tobago and in the region?
Thank you very much again, Dr. Andrew. So yes, we did conduct the first ever community study to estimate the prevalence of PCOS in Trinidad. And what we found was that about 7 to 14% of women are actually affected, which means roughly 1 in 10 women in our community may be living with PCOS often without a diagnosis. So this is very important because PCOS is not just a reproductive condition, but it also has major metabolic and mental health impacts. So by us being able to identify how common it is in our population, we now have local data to help guide doctors, policymakers, and even women themselves towards better awareness, screening, and healthcare.
And you mentioned emotional well-being, mental well-being, and that's often something we overlook with some of these medical conditions. And I'm just thinking back to all of these other conditions that affect people and affect women. I do believe there's a PCOS organization in Trinidad or a PCOS support group for these women. And as you said, as many as 1 in 10 women may be affected by PCOS. And I think I want to talk a little bit about that, Dr. Mohammed, because you're well, I'm going to say a young woman, not a young girl anymore, but a young woman, having grown up in Trinidad. So you could give that perspective. Let's talk a little bit about that emotional side of a woman having PCOS in Trinidad. Is it something that they don't want people to know because of the stigma? Is it, and does that prevent proper treatment and care?
So that's actually a very good question, Andrew. Dr. Daniel, sorry. So a lot of women, they often face late or misdiagnosis because of the symptoms that they experience, which be, as Prof. Azziz said, irregular periods, weight gain, skin changes, because they tend to be dismissed or normalized. So what happens is that there's a stigma that surrounds the infertility and excess hair growth that makes it harder for women to seek help. So additionally, women, they don't connect a PCOS with serious health risk, things like diabetes or high blood pressure or even depression. Now, in our study, we were able to show that there were strong links between PCOS and a simple thing such as acanthosis, which is that visible marker that you will see for insulin resistance that many women tend to overlook. And because of this, what happens is that there's a taboo, because even in certain countries such as India, and we would have had a lot of immigrants from India or even from Africa to our country, there's this taboo that women who do not are unable to conceive, they are deemed like not valuable or worth anything in our country, because the purpose of being able to conceive is that you want to be able to pass on that generation wealth. So it brings a lot of depression and anxiety and feeling of invaluability in women among our society.
And I think you hit something there, hit a nerve for many persons there, because I know for a fact that I know of many women who have had problems having children. Maybe or not because of PCOS, but of course it's caused a lot of tension within the family. It's caused a lot of tension in the household. But yeah, and I think, and I wanted to ask Prof. Azziz about this, and maybe you could answer Dr. Mohammed, which is really how much does PCOS affect conception? How much does PCOS affect a woman or prevent a woman from becoming pregnant?
Prof. Azziz could answer that.
Thank you. So PCOS is the single most common cause of infertility worldwide. So we need to understand that. Having said that, women with PCOS do ovulate occasionally, right? And so they do produce an egg occasionally. And so the fertility will depend on what their desires are and how frequent they have unprotected sex, right? Vaginal sex. So I would say that about a third of our patients with PCOS have had children, maybe 3 over a 10-year period of time, or 1, or whatever their desire is, and don't really have infertility as they express it. But the reality is that what we call subfertility, I want everybody to know this, women with PCOS are not infertile, they're subfertile, right? Their fertility is less than other women. About 60 to 70% of women with PCOS suffer from subfertility.
Yeah, and again, and just bringing that point across again, subfertility, meaning that they have a lower fertility rate, is it difficult for them to get pregnant?
Exactly.
Yeah.
It's more difficult to get pregnant than a normal individual.
Yeah. So I have more questions for both of you, but I want to bring Prof. Sundaram into the conversation. And Prof. Sundaram, of course, is a veterinary anatomist and reproductive biologist. And he's guided PCOS research in animal models. So I want to find out from Prof. Sundaram, because of course, many of the things that we want to find out in humans could be replicated in animals, and it helps us give us a greater understanding of conditions. Tell us a little bit, Prof. Sundaram, how did your research and animal studies help us understand PCOS more in humans?
Yeah, thank you, Dr. Ramu. Usually, we always have a lot of limitations in doing human research in terms of ethical considerations, the cost, and the time involved. So we cannot test several experimental mechanisms directly on the human beings. So in that case, the animal research come and play the forefront role. So usually the rats, mice, and the primates, these are the animal models, which allows us to mimic the PCOS features safely. Say the irregular cycles or cystic ovaries and the insulin resistance. So it is very easy for us to produce these conditions in lab animals, and we can be able to test or do the experiment, whatever we need. In our Trinidad research beginning, we started with the animal models only. We started with the rats, and we tried the environmental exposures like low frequency, electromagnetic, radiation to see what effect on the polycystic ovary model and how it affects the ovary and the hormones. And we really got some early insights in the hormonal pathways that may later be studied in the woman. So animal studies is basically, it's a starting point of the discovery, and they guide the human studies and interventions. So that is how the animal studies helps.
Professor Sundaram, I want to find out, is it that naturally or without intervention, these animals also develop PCOS, or is it something that you induce in them to test? Is it that rats and monkeys normally get PCOS as well?
Usually, it is not like a PCOS syndrome which appears in animals, but they have some condition which is similar to this, like polycystic ovary disease in case of cows. So like that too, they manifest, and the lines of treatment is a little different from what we are doing with the humans.
And so I want to ask, maybe again to Prof. Azziz, because I know we need to take a break shortly, and then we'll open up the phone calls, the phone lines. But Prof. Azziz, we often see non-communicable diseases appearing both in all animal, in all of the animal kingdom. So, for example, I know you may see cataracts in dogs, you may see diabetes in cats, but you don't often see it because, of course, for humans, there's a huge environmental and social influence on developing these non-communicable diseases. Is it so for PCOS? Is it because of our diets? Is it because of our environment that humans are affected by PCOS this much?
That is a very good question. And Dr. Sundaram, of course, is an expert in animal models. But in general, the way we see PCOS is that there is no spontaneous PCOS in animals. There is some over-ovulation. Certain cows, for example, will develop some ovulation and so on, but not truly the PCOS symptoms. So, in fact, PCOS tends to be a uniquely human disorder, which is one of the difficulties, of course, of creating animal models that mimic, PCOS, because, of course, you can't study everything in humans. You can't take humans' livers out and so on and so forth. So this is where Dr. Sundaram's work plays a role. But it seems to be a very much a uniquely human disorder, although I'm waiting for Dr. Sundaram to correct me and tell me, no, I'm incorrect.
Yeah, maybe we find it as something locally, and Dr. Sundaram.
No, so far we didn't experience that one, but what Prof. Azziz told is correct.
Thank you.
And Prof. Sundaram, I also want to ask you, I mean, you've been mentoring young researchers like Dr. Mohammed in this field, and I know you do have other students currently. I want you to tell us a little bit about how important local research is and collaborating with international experts like Prof. Azziz. How has that boosted your knowledge within this topic? How has that boosted the work, that collaboration?
Okay. So the PCOS, as Prof was telling, it can look different in different populations. So in that case, the local research become very crucial. So when we do our Trinidad research, it built the first scientific foundation, showing that what are the unique metabolic and social challenges the Trinidad women and wider Caribbean women face. Then when Prof. Azziz comes into the team and he agreed to help us, then this international collaboration raised the standard of our research. So he brought the decades of global experience while we provide the local context. So this partnership produced a stronger data and more visibility, and it built young researchers' capacity in Trinidad. Even currently, our MBBS students research group, one group is doing a research, trying to find the health disparities in the women with PCOS and other one. And the other two groups already, they are interested and we are planning to proceed. It's an initial stage. So thereby, the young researchers get motivated to do a proper research, and they clearly understand what is our local problem. And with the international guidance, we produce a stronger research and stronger data. So ultimately, we ensure that care of women in the Caribbean should be both world-class. At the same time, it should be culturally relevant.
And that's very important because you can't adapt things that were done in other parts of the world. We have unique cultures, we have unique ethnicities, races, and of course, all of that plays a role. We need to take a break, and when we get back, we will be opening up the phone line, taking some phone calls, taking some WhatsApp messages. Bases in studio, we're with Professor Sundaram, Dr. Mohammed, and Dr. Azziz, and we're a very impressive lineup. We're talking about PCOS because September is PCOS Awareness Month. Base, over to you. Let's take that break and we'll come back.
Cindy, what are you doing home so early?
I come to meet you first to go grocery shopping and to get the kids stuff for school. Boy, I hear my co-workers talking about a grocery in Arima and one in Barataria who have the best prices. Let me go right now.
Oh God, look at this place. I never see a grocery like this in this country.
Darling, look at parking. Like these people own the whole street.
Look at these prices. Everything reduced. You ain't see how helpful and friendly their staff is.
You see, we get everything and still have lots of money remaining to get the kids stuff for school and also to carry them somewhere good for the vacation. If you want to save money and live better, shop at Mirage Westside Supermarket in Arima or Jumbo Foods in Barataria, where shopping is a pleasure.
The big board impact just got even bigger. Introducing 3 new highway billboard locations in San Fernando, Chaguanas, and Paget. That's right, high traffic and high impact spots catered to catching eyes. Whether you're launching a product, promoting a sale, or making a statement, get flexible scheduling, real-time updates, and the most eye-catching and dynamic visuals with free artwork. Go big, go digital, go everywhere with the Big Board Company. 18 locations nationwide. Call 368-3754 for more information.
Let's talk about it because it's natural, it's normal, it's time.
In Trinidad and Tobago, thousands of girls, women face stigma, shame, and silence around one simple fact of life: periods.
It ends now. We're proud to launch Period Proud. Proud, a national campaign bringing period education to the forefront where it belongs.
Men, you have a role to play too. Where is shaping the way TNT thinks and talks about menstruation, from schools to workplaces, from radio to television, to print to social media.
Our expert panel of doctors and advocates will break myths, share facts, and build a culture around respect and understanding because periods should never be a source of shame. It's time to be informed. It's time to be open. It's time to be period proud. Follow the movement across radio, TV, print, and social media. Let's change the conversation, one period at a time. Period Proud, presented by Crown Her Trinidad and Tobago. Sam Brosco, Stay Free, Carefree, Point Lisa's Nitrogen, New Core, and New Iron.
12:40 on time. Remember, any questions, folks, feel free to call us up at 625-2257. 627-3223. You could also send your WhatsApp messages to 306-1065. Special edition of Diabetes and You, talking about PCOS today. Of course, it's PCOS month, the month of September. We return back to Dr. Danu and his guests.
Thanks, Grace. And of course, we're here with Prof. Azziz, Dr. Mohammed, and Prof. Sundaram, and we're talking about PCOS. Again, these are, I would say, some of the world experts in PCOS with us. So we're very much blessed to have them here with us, sharing their knowledge with us. And we've been talking a little bit about the background of PCOS. We've been talking about some of the work done in Trinidad and Tobago, involving animals, learning from animals about PCOS. But I wanna turn to Dr. Mohammed again, and I know that Dr. Mohammed, you would have done this data collection in Trinidad and Tobago, and you would have involved community groups like the Rotary clubs. Tell me a little bit more about the data that you would have collected, how you would have collected the data, and maybe some of the most startling or most the findings that stood out the most.
So at first, in terms of funding, we required funding. So we would have collaborated with organizations such as the Rotary, and I mean, also the ATTL helped us as well too. So it was really important because to have you all had a much larger platform to be able to help us to engage with persons. This was a community study, so we literally had to go house to house, asking for persons like to be able to participate. So we wasn't asking if a person had PCOS, but we were just really doing an assessment on their reproductive health. And it was interesting because a lot of persons were unaware about PCOS. A lot of persons had PCOS and they didn't understand what really is the condition. They didn't understand how they can get help or where they can get information. So that was the purpose of this research as well too. Some of the major findings was definitely some of the findings that has been established internationally, where it is we were able to find that persons in Trinidad, first of all, definitely the prevalence, but also which was very different from the prevalence across different geographical locations. Because according to the World Health Organization, it's approximately 8 to 13% of women are affected by PCOS, with still 70% being underdiagnosed. So this was interesting to understand the prevalence in our country, and the association was with infertility, acanthosis, which acanthosis for insulin resistance, meaning that they are at risk for type 2 diabetes, cardiovascular disease, and other conditions. So I mean, now we actually have to be able to identify more longitudinal data to be able to help assess whether it is they are at risk for these other conditions. We also found a strong association with socio-demographic parameters as well too. So education, their status in terms of their job, and also with health, a mental burden impact was like so great, because it's not only because of them having PCOS, but also them being able to have things such as like obesity or type 2 diabetes. So that had a mental health impact. And something that was really interesting was that it wasn't only the women that were affected, but also the colleagues, their peers, the men in their lives. And this is something that we are trying to also shed light into, because PCOS doesn't only affect the person that is diagnosed with the condition, it affects everyone that surrounds the person. Yeah, thank you, Doctor.
And with that, I have a question for Prof. Azziz from one of our listeners. Can PCOS be prevented or researched or reversed? Sorry.
No, that is a good question that we always get. So PCOS is a genetic disorder, right? But the features of PCOS will vary according to lifestyle and a number of other external factors. So we have not found a way to cure PCOS. So I think that if PCOS is diagnosed, the person will always have PCOS, but they can manage the symptoms so that the symptoms and the features are minimized, right, to the minimum level. But there is no, you can reverse the symptoms, right? I mean, for example, if you're very obese, that will put more strain on your insulin resistance, cause more insulin resistance, more strain on your pancreas. Losing weight will make you healthier. That will bring the insulin levels down. That will reduce the stimulation of male hormones, et cetera, in your body. So you can improve the symptoms, right? Many women begin to ovulate more normally and so on. But in general, you can't really cure it. And I think it's important for patients to understand that.
Thanks for that. And Dr. Mohammed, I have a question for you from a listener as well, because you mentioned about PCOS affecting men as well, meaning that they affect their their partners or their colleagues, but can PCOS in any way, because I know Prof. Azziz would have mentioned it's genetic, there's a genetic component. Can it affect men in any way? I know is there any way that it affects men biologically, not just emotionally? Maybe Dr. Mohammed or Prof. Azziz or Dr. Sundaram to take that one.
Just answer a brief part of that. So in terms of PCOS part affecting men, I know that men tend to tell women, oh, you all have so many crazy hormones, they're always acting up, but they don't understand the biology of a woman, and especially how their hormones fluctuate during like having PCOS as well, or even some of the medications that they are prescribed. So in terms of like the external factor, like having a second degree effect, that's what I would understand. But maybe Prof. Azziz or Dr. Sundaram can share some light on that, the other aspect.
Professor Sundaram?
You have to unmute your phone.
Yes, you can answer this, Prof. Because to my knowledge, androgen excess is the one which we may not be able to categorize the PCOS in men. That is what I understood.
It's a very good point. So genetically speaking, Dr. Danu, this is not a sex-linked genetic issue. Some genes are linked to, your X chromosome, your Y chromosome. In other words, to who you are as a sex. This is not. And so both men and women are affected. Now, Dr. Sundaram is correct. I mean, mostly the signs and features of PCOS, right? Irregular periods, excess male-like hair growth are not visible in men. Either they don't ovulate or all men have excess hair growth, right? But there are other features of PCOS that actually can be detected in men of families that have PCOS genes, right? They can have a higher risk of diabetes. They can have a higher risk of heart disease. They can have a higher risk of stroke and these kind of things. So as we study more families that have men in the family makeup, we are beginning to better define what PCOS in men is like. And that is actually future studies that we have actually planned at the moment to look at that. Even some of the gene markers for PCOS can actually highlight abnormalities of heart disease in men.
That's very interesting because, it's interesting simply because we tend to associate it, of course, with women. Of course, it's affecting women directly, but there's a lot of opportunity for research there to see where the gene may affect or what it may affect, especially in our population in Trinidad and Tobago and in the Caribbean, of course. Professor Sundaram, I have a question for you from one of our listeners. And of course, you would have mentioned using those animal models for PCOS work. What other type of medical research is currently done in Trinidad with these animals? Or what can you tell us about what work that you've been doing with animals?
So right now, I'm not doing any animal research, but for the past 7 years, we did research on the PCOS, try to find out that electromagnetic radiation effect. Then there is another interesting research topic that the Baban Day. What was the effect of Baban Day? Whether it is
Baban Day. Okay. Yeah.
Whether it is really having an aphrodisiac potential or not. And of course, it is consumed without knowing that exactly how much it has to be consumed. So we did some toxicological studies to find out how the Baban Day safely can be administered and what form, and whether it's really having any aphrodisiac potential or not. And one paper published about the safe dose of Baban Day, how much has to be taken. Already we published that one. And the other paper, the aphrodisiac potential, we are just waiting for some of the lab results. So once it is there, we will compile and we will publish that. So regarding the PCOS, after our initial study, we moved to community research and prevalence. So currently, right now, I do not do any animal research for the past 1 year. Yeah.
But what you mentioned about Babande is very interesting. It's something, and it brings to light the use of, well, what we refer to as complementary and alternative medicines, but in Trinidad we call it bush medicine in Trinidad. Yeah. And of course, many persons use bush medicines for diabetes as well, and they don't know, first of all, the dosage they could take, and second of all, if it in fact actually works. So I'm glad that you have been doing that research. So very much interested. I'm sure many persons who may be using that in Trinidad may be interested in finding out if in fact it actually works. So we're looking out for that publication. So we're coming up close to the end of the show, and I want to ask Prof. Azziz, because another question is coming in, which is asking about treatment options for PCOS and how is it treated? How can it be treated?
So there are a number of treatment options, although I will tell you, we're still working on specific treatment options. A lot of our treatments are general treatments, not for specifically PCOS. But for starters, one of the most common features of PCOS is, of course, irregular periods, right? And having irregular ovulation, irregular periods follows irregular ovulation or infrequent ovulation. That creates a risk not only for abnormal bleeding all over the place, you don't know when you're going to bleed, but it also creates a risk for obviously infertility because you're not ovulating regularly, and also for increased risk of uterine cancer, endometrial cancer. So we want to protect women who are not trying to get pregnant from having an increased risk of uterine cancer. And so, for example, birth control pills are a very good way of doing a number of things: protecting the lining of the uterus, reducing male hormone levels in the blood circulation, and obviously giving contraception to somebody who does not want to get pregnant. Very useful. Other forms could be regular monthly cycles of progesterone, right? Some progestin kind of thing to create sort of the shedding of the lining of the uterus to reduce the risk of cancer. But again, it doesn't really reduce male hormone levels and so on, like birth control pills. The second group of drugs that we use for treatment in PCOS is the anti-male hormones, the ones that block male hormones. And we use those primarily for women who have excess hair growth, male-like hair growth, what we call hirsutism. And there's a number of different drugs there that are anti-male hormone, anti-androgen receptor, spironolactone, for example, flutamide could be another one, 5-alpha reductase inhibitors, and so on. Anyway, that's a second group of drugs that you would give primarily to women who are having dermatologic signs of excess male hormones. The third group of drugs that you would consider are drugs that improve your insulin resistance, right? We talked about insulin resistance. Lifestyle modification is important: exercise, diet, keeping healthy, eating healthy. But again, sometimes it may benefit from things like metformin. That's another kind of drug that improves insulin resistance, right? The third group of drugs really are those drugs that actually are used for fertility, right? If your purpose is fertility, can't really take anti-male hormones or birth control pills and so on, because of course that would be contrary to the purpose. But if you're trying to get pregnant, there are drugs there are pills that you can take to make you ovulate. There are shots you can take to make you ovulate. There are even surgeries that can take that you can have to make you ovulate more frequently. And so those are sort of the fourth group of medications that we think about PCOS. Now, we need to remember that PCOS is impacted, and Dr. Mohammed spoke to this, by emotional and mental health challenges, not just because you have PCOS, but perhaps part of the etiology of it. So we always have to remember to ask our patients about their emotional health, their mental health. And again, that's the fifth group, right, of drugs that we might use to help the health of our patients with PCOS, the drugs that may be impacted and may impact mental health.
And thanks for sharing that information. And I mean, it's just coming to mind that, and again, Stephanie, work needs to be done in Trinidad on this, and Dr. Sundaram, that you are in Trinidad as well. I was now about to say, where do you reach out to get more information about this? Because you need to go to your doctor, but it would be very nice to actually have an organization like the Diabetes Association, but for PCOS, to give advice and give support, and you know, so maybe one day, maybe next year when we have this program, because I mean, I would like to keep raising awareness every year in September, as long as I have this show about PCOS. Maybe next year there'll be an organization, yeah, Prof. Azziz?
Yeah, I just wanted to mention there obviously are going to be local sources of information. Dr. Mohammed can speak to that as well in Trinidad, Tobago. But there are the Androgen Excess and PCOS Society has information for patients. The Endocrine Society has information for patients. The CDC in the United States has information for patients and PCOS, and so does the National Institutes of Health, or NIH. These are 4 sources of reputable information for patients. There are other organizations, American Society for Reproductive Medicine, American College of Obstetricians and Gynecologists, all have information on PCOS for patients. My only advice to patients is please seek out information from reputable sources, not just from fly-by-night websites that are trying to sell you something, or from just anybody who feels they want to put in an opinion on the web.
Yeah, there's TikTok influencers, so be aware of them. So I.
On top of that, last year we would have had Miss Sasha Oti from PCOS Challenge in Zinc. She's also has been doing a lot of collaboration with Prof. Azziz and Prof. Sundaram and myself. So, I mean, she actually has a large advocacy online platform, and they also give subsidies for women that are trying to become pregnant as well too. So that organization is very good. That's what we've been recommending to a lot of people. There's also a Facebook group and a WhatsApp group right now where we have a community. It's run by, I think, Miss Carissa or something like that. But she's a very nice person.
In Trinidad, yes, there's a local group. Yeah.
Local group. I'm part of that group as well too. So women, they're always posting information where they want, emotional support. So I would suggest people reach out.
Yeah. So what you could do is you could share that with me, and we'll share it on the diabetes pages. So if persons would like to join that local support group, very interesting. Very much happy to hear that something is there. We just have a couple minutes left to the end of the program, and I want to put everybody on the spot now by asking you a question that I want you to just give me a response in about 30 seconds, because we've been talking about PCOS and we've been talking about people around women with PCOS. But I want to find out from each of you, what advice would you give the support structure? What advice would you give the family members, the partners, the co-workers of people who may have PCOS? What advice would you give them towards helping those persons? I want to start with Prof. Sundaram.
Yeah. So stay stronger and be aware and do early diagnosis and make lifestyle changes. Then they can have a healthier and fuller lives.
Thanks for that. Prof. Azziz?
Yeah, I agree with Dr. Sundaram. I think relatives of patients with PCOS need to A, understand this is a genetic thing, B, that other relatives are going to be affected. And so the sooner they can be identified, the better, because it's better to start treatment early. Thirdly, that it has a significant mental health impact. So they need to be very supportive of their relatives with PCOS. And fourthly, that they really need to help their patients with PCOS seek medical care from reputable sources soon, right? Very often women tend to think, oh, God made me this way. There's no reason for me to look at this. And this is not just about how you look and how your periods are. This is about health, diabetes, insulin resistance. And so you need to do that. So family members should encourage, again, their loved ones and their friends and so on to seek medical care, because there is good medical care and there is treatment.
Thanks for that. Prof. And Dr. Mohammed?
I mean, if you are not alone, if you notice any symptoms like irregular cycles, acne, excessive hair growth, or even dark skin patches, just talk to your doctor. PCOS is common, it's manageable, and with the right care, I mean, you can protect your reproductive, your metabolic, and your emotional health. Awareness is the first step towards empowerment. We are here, we are the scientists in the lab, we're looking out for you all, and we are going to continue supporting you all.
And with that, I want to thank Dr. Mohammed, Prof. Azziz, Prof. Sundaram for joining us here on Diabetes and You this week. Next week, we're going to have another exciting show again at 12 noon. Every Thursday, we're here. In the meantime, if you do need support from the Diabetes Association, reach out to us at